This is Highmark's 7th year supporting Ellis Medicine's Women's Night Out, now Women's Day In. And to be honest, it is my personal favorite. I love going and interacting with all of you. It's always so much fun. And I'm so sad we can't see you in person, but hopefully next year. And of course, I always enjoy the panel discussions and the Janie Award. So thank you for everyone that is joining us this morning. And I'm sure you're all as excited as I am to hear the expert advice panelists that will offer us information this morning on the very hot topic of COVID-19. Thank you.
Thanks. Thank you, Nicole. And a special thank you to all of you who are on this Zoom. Your support is instrumental in helping the Ellis team care for women in our community. Who would have thought back in March of 2020, we would still be talking about COVID in October of 2021? Well, here we are. And though we have learned a lot in the last 19 months and are certainly in a much better place today, everyone still has some questions, unknowns, changes. We've all had to pivot, repivot, and pivot again, which is why we decided that it would be good to connect you with the COVID experts here at Ellis Medicine. So this is your chance to ask questions about COVID, receive the answers from the healthcare providers who are on the front lines, and really great panelists. So I'm really proud to introduce our speakers today. First is Dr. David Liebers, our very own Dr. Fauci. Dr. Liebers is board certified in infectious disease and has been leading Ellis and our community through this pandemic. Our next presenter is Chrissy Curcio. She is director of the quality department and has been boots on the ground since COVID hit our community. As a matter of fact, she's our in-house go-to person when any of us have questions about our kids, our family, our husbands, our parents. Where do I get this? How do I get that? She always answers all of our questions with a smile and incredible amount of grace. Chrissy has organized community testing, vaccine distribution, and is our personal go-to person here at Ellis. Mary May has seen firsthand the impact of the pandemic. Mary is the clinical manager of our outpatient mental health services. And it's no secret that the mental health has suffered. And Mary's going to talk to us not so much about that we should be more mindful and we should sit in yoga classes, but talk to us about knowing when it might be time to ask for help as we head into the winter. Some really honest, real conversation. So thank you, Mary, for that. And before I would turn it over to Dr. Liebers, we hope you have a lot of questions. Please enter them into the Q&A box. And now I will pass it over to Dr. Liebers. Dr. Liebers?
Good morning, everybody. And it's a pleasure to be here. And thanks for providing an audience, Marcy, because information is very important, as you know. A couple of things to start out. You mentioned, Marcy, learning, right? We're always learning. I think we are still learning a tremendous amount about COVID, how it's transmitted, about the variants, how to prevent it, how to use the vaccinations, the monoclonal antibodies, and the development of antivirals, which is still ongoing. So there's a tremendous amount of learning going on. Therefore, that idea of pivoting becomes important as well. And one of my colleagues at St. Peter's Hospital, even earlier in the epidemic, told me, I'm calling myself Dr. Pivot because I'm changing my mind so frequently as changes occur. Obviously, we're all very hopeful this summer, May, June, early July, as cases fell. But then, of course, the COVID variant of the Delta emerged. And the Delta variant was a mutation of the original wild-type COVID virus that behaved a little differently. It grew up in higher concentrations, as such became more transmissible, seemed to have higher affinity for the receptors in our body to which the virus attaches, and ultimately was shown to be more likely to infect individuals who had been previously vaccinated. And we have learned that the vaccinations do wane over time, and that leads into our discussion about boosters and third shots, et cetera. Currently, after hitting a nadir in mid-August, where we had no patients in the hospital, I would say, beginning mid-September till now, we've been plateaued both in our community and in the hospital. And this is in spite of information you hear nationally that cases are falling. In New York State, actually, cases are falling, but that's led by the New York City and Long Island area, where cases have been falling considerably, whereas cases in some respects have peaked in upstate. In places like the North Country and the Mohawk Valley, we're seeing the biggest surge yet in the COVID pandemic, and we're influenced by that a little bit. So currently at Ellis Medicine, we stand at 24 patients who are actively infected with COVID in the hospital. In fact, we have 7 others who have been de-isolated and moved out of the COVID units. So our impact at the hospital is quite high. We have 31 patients, which is really a considerable proportion of our inpatient census. In Schenectady, we're still seeing 50 to 100 new cases every day. Interestingly, 1/4 to 1/3 of those are in individuals under 18. So a lot of transmission occurring in children, and that transmission in children can result in transmission within the household and perhaps infect our most vulnerable. So we are at a plateau. The hospital is handling it very, very well, I'd say. Again, I want to give credit to in terms of leadership, our frontline staff has been leading us. They are caring for a COVID patient day in and day out. We have had to deal with, patients going on ventilators, deaths, a continued parade of new patients, and our team, the frontline nurses, techs, and ancillary folks who man our ICU and the C6 unit where we house our COVID patients, as well as our hospitalists and critical care doctors and the ED, have not wavered and continue to push on and do a wonderful job caring for our patients. So vaccinations is a hot topic, as you know, in the news. There are a number of developments. And I'll start with the third shot. Now, the third shot and the booster are actually 2 different things. We know now that people who are very immunocompromised, for example, folks with stem cell transplants, patients with solid organ transplants, patients with lymphoma, and others who are in high dose medications that suppress the immune system, like prednisone and other biologic medications, do not respond that well to the first shots or the first series of the mRNA vaccine, the Pfizer and the Moderna. Therefore, at about 28 days, and this is new data, we recommend that a third shot be given routinely in that group of patients. The boosters are recommended for a subset of our population who have already been vaccinated either with the mRNAs, the Pfizer or Moderna, or the Janssen vaccine. With the mRNAs, boosters are recommended for everybody over 65. In the 18 to 64 year age group, we recommend it for high-risk folks, diabetes, obesity, lung disease, a variety of comorbidities. We also recommend it for those in that age group, 18 to 64, who are in high-risk occupations, healthcare workers, emergency responders, and other occupations, even folks on the front line in community settings that have a lot of exposure to potentially infected individuals. So we're still looking at whether boosters are going to be approved for everybody or not. That's still in study. Important, if you had the Janssen vaccine or the Janssen, it's pronounced both ways, everybody who had the Janssen vaccine should get a Janssen boost. And that could be given as early as 2 months after the initial shot. I know you're going to ask me about the mix and match. And indeed, it does appear that boosters can be given with any of the available vaccines. There is no specific guidance to that at this point, and generally we're giving folks boosters with the same vaccine. Currently, Pfizer to Pfizer, Moderna to Moderna, Janssen to Janssen. Natural immunity. Certainly, natural immunity helps, but it does appear that natural immunity is not enough to really prevent COVID vaccine. That is, you've been exposed to COVID, you develop an immune response, which is creation of antibodies and a lot of other complex changes in our immune system that allow us to respond to a re-exposure to COVID. It does appear that natural immunity plus vaccination may be more robust than either vaccination alone or natural immunity alone. So we recommend that anyone who has been infected with COVID get a vaccine as soon as the symptoms of COVID, if unvaccinated, are ameliorated. Pediatric vaccination is, I think, right around the corner. As you know, the FDA Advisory Committee looked at the Pfizer vaccine and recommended that it be given to those ages 6 through 11, that it's safe and effective. It is a lower dose. The Moderna and Janssen vaccines have yet to been approved for that indication. And in fact, Pfizer is the only one approved and used in the 12 to 18 age group. And I will say in our community, there's a very high rate of acceptance even in that teenage year group with vaccination. Once pediatric vaccination is available, I think it is important for those children to be vaccinated. Again, many of our new cases are coming up in children, and those children are potentially vectors of spread to the more vulnerable individuals. It's absolutely clear that kids in that age group are much less likely to get sick. I think so far in the pandemic, there are about 94 confirmed cases of COVID deaths in kids under 11. Still too many. I also want to mention a little bit about the monoclonal antibody. The monoclonal antibody therapies, there are two different companies, Regeneron and Lilly, that produce what they call a cocktail of monoclonal antibody. These are antibodies that are designed to attach and block the mechanism by which the virus attaches to our cells. If a virus can't attach to the cells, it cannot infect us. And the Delta agent is blocked by both the monoclonal antibodies. In individuals who are high risk, who've either been exposed or have early mild disease, the monoclonal antibody has received emergency use authorization to be infused in those individuals. We're also looking at other ways of delivering the monoclonal antibody, such as subcutaneous injections. Here at Ellis right now, we're offering the monoclonal antibody, both the Regeneron and the Lilly product, to those individuals in high-risk groups, as I mentioned earlier, who have been strong exposure or early infection. The monoclonal antibody has not been authorized for treatment of hospitalized patients at this point. It's interesting, the monoclonal antibody was initially felt to be relatively ineffective, but the latest data shows that it may decrease, if given early, hospitalization and death by 70%. And again, this is in high-risk individuals.
Good. Dr. Liebers, this is Marcy. I got a couple of questions for you.
Sure.
From our audience today. The first, what symptoms are to be expected, if any, from the boosters? Are there different symptoms, or are there different symptoms for Pfizer versus Moderna?
So we don't have a good idea about the Moderna booster yet, right? Because we haven't been giving that. I think the Pfizer symptoms are probably about the same. And I have not heard any difference. So remember, the Pfizer might give you within 24 to 36 hours a low-grade fever, maybe a chilliness, a flu-like sensation, as well as a soreness at the arm. There have been rare cases, though statistically significant, in young men of inflammation of the heart or the lining around the heart. What we know so far is that that symptom or that finding seemed to be more common with the second Pfizer shot. The early news on the booster is that it may be less apt to produce that side effect or adverse reaction with the Pfizer.
Okay. So this is a follow-up question, and I think probably I know, Chrissy, you have something that you wanted to add to Dr. Liebers?
Yeah, the only thing that I would add in addition to what Dr. Lieber said is with Moderna, we did identify with the second vaccine, and we're kind of, like Dr. Lieber said, waiting to see what happens, is that there's like an immune response at the injection site, which initially people thought was an infection. We started calling it a COVID arm. I'm sorry, not COVID, I'm sorry, Moderna arm. So that's the only thing I would add to it. And we're waiting to see what happens with the booster, but it's something that resolves usually in a couple of days. But Dr. Lieber can speak more to that.
Yeah. And as Chrissy said, and you probably saw more of it than I did, inflammatory reactions at the injection site with the Moderna.
Okay, a couple more questions. What will the process be? And I don't know if it's Chrissy or Dr. Liebers, for getting a child vaccinated. The government recommends calling your pediatrician ASAP. Will doctors' offices have the shots, or will there be a vaccine site we need to visit?
You
Chrissy,
want me to answer? Yeah. So what's interesting about Pfizer, and they are changing, but what makes it difficult to administer sometimes is the temperature that you have to keep it prior to thawing and administering the vaccine. We are currently working, once New York State approves it and the CDC approves the vaccine for that younger age group, we are working with Schenectady County to run a vaccine clinic here at Ellis Medicine, where it's given right here close by the emergency department and by trained and qualified nursing and pharmacy staff. But there is a lot of local providers will be doing the vaccine, but it's a matter of, do they have capability of keeping at the temperature it needs to be kept at the period of time? And that's really the limiting factor. But Schenectady County is working and collaborating right now with pediatric offices to determine how this is going to be done. And we're expecting any day they're going to give the okay.
Yeah.
Good. Thank you so much. And we have another question. Do you feel, Dr. Liebers, that down the road that we will all need, very much like an annual flu shot, an annual COVID shot? Any science on that yet?
Yeah, I don't think we have any science on that yet. Again, I think we're still learning, but I think it's a possibility. Yeah.
Okay.
I do think it's a possibility. COVID has hung on, and its ability to mutate, I think, portends the possibility that we're going to be developing COVID vaccines at regular intervals. Maybe it's not every year, but at regular intervals to deal with whatever mutations come on down the road. What's interesting, though, is Delta has pushed all the other mutations out of the picture completely. Delta is by far the super dominant strain right now. And there is work being done on a vaccine that's looking at Delta.
Okay. Dr. Liebers and Chrissy, a great question just came in, and probably very applicable to so many people. Can you speak a little bit about how you treat COVID once you get it? Not so much in the hospital, but if you are at home, what is the treatment? What things do you need to do? So Chrissy, Dr. Liebers, could you, that's a very practical question that many of us have, because we have loved ones who might have COVID in their home, and how do we care for them?
I'll let Dr. Lieber speak.
Yeah, so I think the most important thing is to communicate with your physician, such as to, first of all, is this a high-risk individual who is sick, or if it's you, getting monoclonal antibody, and anyone over 65 is high risk, recall. So if one has COVID early or is exposed to it, monoclonal antibody is something that should be considered and given. The other thing is just to monitor one's health with the doctor. In other words, looking, at your breathing. Is there any shortness of breath? If there is, that should be assessed. It's really monitoring yourself very closely in conjunction with your physician, because COVID is very variable. You can get infected and then get sick 2 weeks later. Okay. And that is something that we have to keep in mind. So you have to be in close touch with your physician.
Chrissy, can you add to that real practically?
Sure. And I share too. I've had a lot of family members who've contracted COVID, unfortunately, and have given the same advice. So I think the first, and Dr. Lieber should probably reiterate, is moving. So I think, you want to rest, right? Rest, fluids,
yep.
Take care of yourself, your nutrient, and allow your body to rest. But as well, get up and move. I think, it makes you feel so lethargic and drained. However, not moving and sitting sedentary can actually be very damaging. You can actually do proning at home, which just laying on your stomach on the bed or laying your head off the head of the bed, just to allow from that drainage. But getting up and moving, doing deep breathing and coughing is really critical. So I know there's some people I talked to, employees that had it, and we talked to them about when they're watching TV and a commercial comes on, do some deep breaths in, hold that breath, and then huff and cough it out. So those same things that we would do for anybody with like a bad viral respiratory illness. And I think, I don't know, Dr. Lieber, anything else? Those are the biggest things that I tell people.
That's really important. And I thank you, Chrissy, because I'm taking care of hospitalized patients, no outpatients, but also to remain hydrated. It's very important to stay hydrated. And again, to notify your physician if you're not doing well, because it is early recognition of folks who are going to need hospitalization helps out a great deal, because there are treatments that we give in the hospital that are not really suitable for giving at home.
Okay, all right. That was a great question. Thank you, whoever asked it. It was dynamite. Okay, so so I think now we're going to move on to, and thank you, Dr. Liebers, for your expertise, and you're always so calm, and we so appreciate that. Now we're going to turn it over to Chrissy Curcio. She is our in-house person, and Chrissy, what are some of the things you're hearing? What can you tell us about navigating this new COVID world? What kind of questions are you getting, and just some good thoughts around that?
Sure. So I think the first one, and Dr. Lieber's touched on this already. In fact, this past week, I've been asked 3 times, how do you tell the difference between COVID and a common cold? And I think the biggest thing is that you can't really initially, COVID presents differently in so many people. You can have one person who has like a classic respiratory illness, and someone else may have like GI or gastrointestinal symptoms that may be predominant. So you don't know. And it's similar, the symptoms are similar to common cold, flu, RSV, which we've seen a little uptick of. So you can't tell. And because of that, you need to immediately, if you have concerns, engage with your primary care provider, whoever is navigating your care, and let them know, because that wait and see mentality can be dangerous. If maybe you're having mild symptoms, but there may be someone that you expose that's not going to have the same course of illness, and they can be really dangerous because every person is so different based on how their body reacts, but also the strain. The other thing too, and Dr. Liebers can pop in on this, is that, we're identifying there's something called post-COVID syndrome, and, knowing that you've been tested and the results of that test may be very valuable to your provider after your illness to identify symptoms and things you're experiencing with the illness. We've had people that have been readmitted to the hospital after their course of illness with like this post-COVID syndrome of breathing and so forth. And I don't know, Dr. Liebers, if you want to add anything to that.
So it's, COVID really is basically 2 phases. One is, we call it the viral replicative phase. And that's where the virus is attaching to your tissues and invading tissues, in particular the lung. That actually is a fairly short phase. And in fact, we believe that most patients who are COVID positive are no longer transmitting virus by maybe day 8. With immunocompromised folks or transplant patients, it might be much longer than that. But certainly the average patient doesn't have active viral reproduction in the body for very long. But then the subset of patients who get very sick go into what's the inflammatory phase. And that appears to be a perturbation of the immune system where the body, like in sepsis, is going overboard in attacking the virus, but actually attacking our own tissues and causing inflammation of the lungs and sometimes other organs with heart failure, kidney failure, that kind of thing. So it can be stretched out a little bit in that regard. Yeah, go ahead.
No, I'm sorry. I would just add something interesting about, people maybe underwhelming their symptoms. What became a telltale sign, and I've tested a lot of people, is when they go to test them, they have a certain look on their face, but they go, this is just allergies. And in my head now, whenever someone said I just have allergies, I was like, their test is going to be positive. So it just, it shows how it could just be person to person. Don't underestimate your symptoms. Don't try to self-diagnose. Talk to your provider.
And in terms of unique symptoms, some people will simply lose their sense of taste and smell. And yet those individuals may well be transmissible. So that's another feature, because we do know there's a big subset of individuals, probably young people in particular, who are asymptomatic.
Now, I have another great question here. Should women in the 18 to 48 age range still refrain from getting the J&J vaccine?
Dr. I don't think anything has come out new for that.
Right.
Especially now with there being the options of Pfizer and Moderna, and they are in that age group, especially childbearing women, are promoting greatly the vaccination. So I think right now we haven't heard anything new about it, but there are other options. Maybe do that until we have a clearer picture.
Yeah, I would totally agree with Chrissy. We have other options. The J&J did have a very small number of the hematologic disease called TTS that could be very serious. And I think it's reasonable to go with the mRNA vaccines.
Okay, so
in terms of women, I want to also add, we are strongly urging pregnant women to be vaccinated. Strong, strong, strong. The data on the outcomes when women, very much like influenza, get COVID when they're pregnant is quite clear that the mom's complications and baby complications are significantly increased. So pregnancy is an indication for COVID vaccine above and beyond the basics.
Yeah, and that's endorsed as well by the American College of Obstetricians and Gynecologists. So it's big endorsement from them even early on.
Okay. I have another question. I have symptoms, don't really feel too good, but my doctor won't see me. Chrissy, what do I do?
Okay. All right. So now the options are really limitless, but I want to kind of make sure everyone understands, and Dr. Lieber's course will supplement. We kind of go pair and pair all the time, so he'll know when to jump in. So we have, you can get testing at CVS right now. You can also get testing at any urgent care does testing. Our Mohawk Harbor does testing. Has a lot of hours, and our emergent care in Clifton Park also does testing. And our emergency department does do testing, but we ask, you only reserve that if you have symptoms that need to be emergently managed, like inability to breathe and so forth. So the options are limitless. One thing I want to just add is antigen testing. So a lot of times people are looking for a rapid test, and they will go to a different place and say, I want a rapid test, and understanding what a rapid test means. So a lot of rapid tests that you're getting in the community are antigen testing. And I just, as a word of caution, so if your kids had a strep test, like a rapid strep test in the office, that's a type of antigen testing. And it detects for like a viral protein on the surface of the COVID-19. And it can be very accurate, but the problem is, like with speed, you lose something, right? There's a trade-off between speed and accuracy. So the problem is the antigen test often fails to identify people actually infected and can have a high rate of false negatives. So that's just a word of caution. In some facilities and schools and workplaces will not accept an antigen testing. So when you're getting testing, making sure, is this an antigen testing or a PCR test? And the PCR test is the gold standard that we use here, upwards of 95% accuracy. And it doesn't matter, unlike the antigen test where it's best in the early stages of your illness, the PCR test is at nighttime, and CVS and those places do offer that. The other is Schenectady County was offering a lot of testing initially, but they've really changed their focus to vaccination, which is what we're all focusing on right now. So your urgent cares are your tried and true. And again, Mohawk Harbor does that testing, as well as our Clifton Park emergent care. All the testing.
So Chrissy, here's another question. So I don't have symptoms, but my husband's positive, my kids are positive, or I've been exposed, but I don't have symptoms. Can I still walk in? Can I still go to CVS and get a test?
You can, but again, and Dr. Liebers can add this, the course that we've been saying all along is just because you have a negative test doesn't mean that you're out of the woods, which is why that quarantine period is more valuable. And a lot of the testing works better when you actually have symptoms. So to stay home, and Dr. Liebers, I don't know if there's anything you want to add or correct me on, because this information changes daily. But it's still, the quarantine is your best lay of the land. If you're not experiencing symptoms, still continue to use best practices as identified by the CDC in your own home, quarantining, mask use, and so forth. But I don't know, Dr. Liebers, if there's anything you want to add to that.
So I think with the Delta agent, we know that when you're exposed, you probably will begin shedding, if exposed and infected, shedding virus in about 2 days. But you may not feel any symptoms till 4 or 5 days or longer. So it's generally felt that you may be maybe most transmissible when you're asymptomatic. That's a feature of COVID, which is a little bit unique compared with other viruses, and it's been a big problem. So as Chrissy said, if you're in an environment where COVID is spreading, you may very well have no symptoms and maybe even a negative test initially. And then a couple of days later, your test will turn positive, and then you'll be sick 4 or 5, maybe 6 days later. It does appear that the new Delta agent is quicker. It infects more folks. The incubation period is a little bit shorter in terms of the evolution of symptoms. And probably the rest of the course is very similar to the others. But it is a higher transmissibility, a shorter so-called incubation period, higher, and then generally you get sick a little bit faster.
Okay. Dr. Liebers, I think we've got one final question for you or Chrissy. Can you speak to the claims that vaccines can cause infertility in women? And what should women trying to conceive know about getting vaccinated and any potential risks? Dr. Liebers?
I have no knowledge of any evidence that would suggest that infertility is a outcome of vaccination. And that's been claimed for a lot of other vaccines as well, by the way, with the fears of vaccination. If a woman is trying to get pregnant, it's very important to be vaccinated, because if you become pregnant and get infected, there's an increased risk of loss of the baby, and increased risk of serious outcomes, hospitalization, and death in you.
Okay. Thank you so much for that. If you have any more COVID questions, please keep putting them in the chat box. But I'd like to thank Chrissy and Dr. Liebers. I know, Dr. Liebers, you may have to cut off, because I know you got to see some patients, but I think, Chrissy, you're going to be on. So thank you for that. Very, 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 very much. Now we're going to move, we're going to hear from Mary May. Mary, again, is our go-to in-house for all of the staff, when we have a mental health issue of ourselves or families, give me Mary's number, because Mary is a tremendous resource, a wealth of information. She has been doing this for a very, very long time. Mary's going to talk about, how to do a mental health check-in, some strategies to keep you mentally well as we enter another winter season with COVID, some strategies may possibly to help you and your family, but also some phone numbers and some resources. Those slides are going to look very, very dense when we get to those, but we will make sure that everybody gets a copy of all of that information. So welcome, Mary. Thanks for being on the panel, and welcome.
Thank you so much. Hi, everyone. Well, I'm going to try to keep this as upbeat as possible, but I'm going to talk about some difficult things right now that are going on in the country, first of all. And the bad news is that mental health and substance abuse problems are on the rise in 2021. The Washington Post recently had an article reporting that 50% of Americans feel that COVID is impacting their mental health. And a federal emergency hotline recently saw 1,000% increase in usage during COVID. Not to make it even worse, alcohol consumption in the US is at the highest level since 2002. And since the beginning of the pandemic, the number of people who received a liver transplant due to alcoholic hepatitis or were put on a waiting list has been 50% higher. That's 50% higher than what was forecast based on pre-pandemic trends. And, because people are losing jobs, having children doing school online in many cases, needing to quarantine, this increase in drinking at home has resulted in an increase in domestic violence and child abuse reports as well. So that's the bad news. The good news is, if you are feeling stressed and sad at times, that is a normal reaction to what's going on in our world. Because, we're not just dealing with COVID, we're also dealing with a highly divisive political environment right now, lots of natural disasters, climate change, gun violence. So, it's kind of to be expected that you'll feel a certain amount of sadness, depression, loss. So I think instead of my talking about like all the things you can find online about how to manage your stress through mindfulness and exercise and healthy diet and yoga and hobbies, I think it's more important today that we talk about the difference between situational sadness and anxiety and mental illness. And when I use the word mental illness, I mean literally. There are times when we have so much stress, it's so unrelenting that our brains actually become sick. Our brains actually, our brain chemistry becomes unbalanced. We might need a little more dopamine or a little more serotonin for us to function. And that's the difference between situational sadness and anxiety and when we're actually becoming ill. It's one word, functioning. So that means, how are we functioning in various environments, at home, at work, at school, socially? If we're not functioning the way we used to function, that's when it's time to get help. So let me start with I'm just going to talk about signs of depression where you really need to seek help. And I'm going to start with the worst case scenario, which is where you need to get help right away. And these are the symptoms of a major depressive episode. So there are, when I'm evaluating someone for depression, there are we look for 5 symptoms out of the 8 following symptoms, 5 symptoms, okay? And they have to be present for 2 weeks, and they have to represent a change from your previous functioning. And at least one of them has to be one of the 2 first things I mentioned. If you have a depressed mood most of the day, nearly every day, and I mean like sad, empty, hopeless, either you report this or someone else observes this in you. That's one of the first things. And in children and teens, instead of a very sad, empty, hopeless mood, it can look like high irritability. The second thing that we look at is there a large, dramatic decrease in interest and pleasure from all or almost all activities most of the day, nearly every day? This is really important because you can see this. Other people can observe this in you. If you have a friend who you always loved doing certain things together, going to the movies or whatever, and they suddenly are like, blah, and they just can't get any pleasure from anything, that's a huge warning sign. Significant weight loss or gain, significant decrease or increase in your appetite nearly every day, insomnia or too much sleep nearly every day. And then there's what we call psychomotor agitation. Or retardation, slowing down. This is something that others have to observe in you. It's not just a feeling of being anxious. It's that the feeling of anxiousness makes you have movements without you meaning to. You're tapping your feet, you're moving, you're fluttering your hands. Fatigue or loss of energy nearly every day. Diminished ability to think, concentrate, make decisions. It's almost like your brain becomes hijacked. And recurrent thoughts of death. Now, I would also add that if you observe that a person's hygiene dramatically changes, we always look for that in our practice. If someone that you know who's always meticulous about their hygiene and they always look put together, and now you're noticing lately that they're not showering, they smell, they're not putting on makeup anymore, or brushing their teeth, or their hair is always a disaster, that could be a sign of depression also. So these are symptoms, but then also these symptoms have to cause significant distress or impairment in your functioning. That's the main thing. And they shouldn't be attributed to the physical effects of a substance, drugs, or alcohol, or medication, or a medical condition. I'll talk about types of treatment after I go over anxiety. So again, it's totally normal to be anxious at times. I know I am. We all worry. But signs of anxiety that might need treatment is if you've had excessive anxiety and worry more days than not for like 6 months. You have difficulty controlling the worry. And you have to have 3 or more symptoms present, but this is for adults. If there's only one symptom for children, that could be a sign of excessive anxiety. So it'd be restlessness, heat up, on edge, easily fatigued, difficulty concentrating or your mind going blank, irritability, muscle tension, and sleep disturbance. These symptoms have to cause impairment in your functioning. And again, they're not due to the physical effects of a substance, a medication, or medical condition. So you'll notice that a lot of these symptoms of depression and anxiety are the same, and it's very often that people are experiencing both. What kind of treatment is available? First of all, that worst case scenario I talked about with a major depressive episode is one where you need to get help right away. So the types of treatment for both of these conditions would be a combination of medication management in some instances where an antidepressant can help with both the depression and the anxiety. Then there's psychotherapy, or what we call talk therapy. And in some cases, you might not need either. You just might need family or marriage counseling. I want to talk real briefly about medication management, because a lot of people, when they hear that right away, they're like, oh, I don't want to take a pill, or I don't want to take an antidepressant, that's a crutch. And what I usually say to them is, if you have diabetes and a doctor asks you to take insulin, would you call that a crutch? No, you would not. You would take the insulin because you would need that to stay alive. And it's the same with very serious depression. It's a physical illness, your brain is affected. And there are times when everyone can benefit from a brief time on an antidepressant. They worry about side effects. We have many antidepressants on the market now that have been on for many, many, many years and with minimal side effects, well tolerated. People worry about dependency on medication, and that's a fallacy. An antidepressant is not a drug of addiction. So then talk therapy, 12 weeks of cognitive behavioral therapy has been found to be very effective as medication for depression and anxiety. The only problem with that is that it takes 12 weeks. And sometimes you're in such bad shape that you don't have 12 weeks. So you really need to get something right away. I want to refer to the resource list that I gave, because right now it's very hard for people to get into treatment sometimes because agencies are overwhelmed. So I hear about private practices being overwhelmed, community resources are overwhelmed, people don't know where to go. So I did give you a list. This is a short list, but there are many more that you can find online. But I would say, first of all, start with if you or someone else feels suicidal. I mean, you are thinking of, you hate your life and you're thinking of actually killing yourself. This is not, you don't screw around, you call 911, you get your friend immediately to an ED. Short of that, the ED is not the place to go, really, because there are so many other things going on right now in our society that the EDs are not a very calming place. So I would say if you're feeling crisis, but your life is not in danger, I would recommend going to the Ellis Living Room, is a crisis diversion program that we have here at State Street. We have licensed clinical social workers that you can speak to, help you decrease your stress, and then help you get a referral somewhere. That's a great place to go when you're in crisis. I've also given a list of crisis lines. But in terms of less than a crisis, if you just want to get into treatment as quickly as possible, and you think that you might benefit from a medication, and you have lots of natural resources, you have like natural supports, people that you can speak with. Let's say you have lots of really smart friends that you can talk with, and you're not really sure you need counseling, but you really feel you need a medication. The first thing I would start with would be your primary care provider. A lot of them are very comfortable prescribing for depression. And sometimes they even have social workers in the office that will give you some short-term therapy. For children, school social workers often can give short-term support, or you can talk to your pediatrician. If you're working, your company's employee assistance program can help you. And then if you have private insurances, sometimes it's easier to find a private practitioner instead of going to a clinic. I gave you some resources for that. If you do not have a private insurance, people on Medicaid and Medicare often have a harder time finding good providers. The Ellis Outpatient Mental Health Clinic, we have an adult clinic and a child and adolescent clinic. We accept all insurances, and we have a really wonderful staff of medication providers and therapists. I've given you also some ideas about telemental health services. I do not recommend that over in person. I think there's nothing like talking to someone in person, but in a pinch, you know, I've given you the numbers of a couple of really reputable telemental health service providers, as well as some counseling agencies. I've also given some recommendations where you can go for substance abuse help. And lastly, you might not even need professional help or treatment. You might be able to just get enough emotional support from some of the things I put on my resource list, such as speaking to a pastor or a reverend or your rabbi if you belong to a religious organization, some support lines, a peer support group, a warm line. Peer just means other people that are struggling with depression, anxiety, and some other social recommendations. So I hope that helps. Does anyone have any questions, or is there anything that I've missed?
Anybody have any questions? Mary, I have to thank you for that signs of depression and how important it is as we're interacting with our family and our friends.
Right.
If we observe any of those changes, sometimes we're hesitant to say something, but
Right.
you know, that's a piece I really wasn't aware of, that a lot of it's observed. And then
Right.
can you go back for a moment when you were talking about anxiety, a question you had listed a number of symptoms, and you also talked about children. Is there one particular symptom that stands out for children above the others?
Probably what I've been seeing from our child and adolescent clinic. I'm by no means an expert in children, but children, especially young children, like who are pre-verbal, like the older teenagers, 12 and up, they will tell you that they're sad. We're getting a lot of referrals from kids who say, I don't want to live anymore. And we're seeing an alarming rate of this, actually. Kids who are cutting, suicidal, openly unhappy. But the little kids, 5 and under, there you're going to see more behaviors like the restlessness, highly irritable, crying, tantrums, more than usual. I mean, little kids are pre-verbal to begin with, so they don't really respond so well to talk therapy, but they respond well to play therapy. And we do have 2 really excellent play therapists at our child and adolescent clinic. And they play with them, and things come out in the play that they're worried about, that they can't talk about, but they show it through things that they draw and build, play with. So I guess younger children, it's change in behaviors. Older kids, they'll tell you.
Awesome. Thank you so much, Mary. That's been wonderful. We're almost out of our time. We have approximately 4 minutes left, and we'd be happy to take any further questions from anybody. I know there were a couple of questions that needed Dr. Liebers, and he had to step out, so we will connect you with him so he can answer your more clinical question. So thank you for those. That was really, really good. And the list of resources that Mary provided for us, we will make sure that everyone on this panel discussion, all the participants and all of you have all of those resources. So as a way of closure, I would like to thank Dr. Liebers. I would like to thank Chrissy for your wonderful presentation and a resource of information. I'd like to thank Mary and also the committee, the Women's Night Out Committee, chaired by Pam Meggs and Brooks Bergen, and their great team for putting all of this together. Our education panel programs was coordinated and chaired Bonnie Keller and her team. Thank you everyone for participating and supporting today's event. Your participation is really key to Ellis, that we can continue to provide innovative and groundbreaking programs and provide the best care for women and their families in our community. Join us at 12 noon today for our panel on our new medical oncology program. And again, for the Janie Award, the Jane Golub Leadership in Women's Health Award, that we will be presenting at 5 p.m. today. But Women's Day isn't over. Visit our silent auction and there are some wonderful things you can you can bid on. No worries about shipping delays, and your participation supports women's health. Thank you so much for being with us today. This was a great way to start Women's Day in. Until next year, thank you.